Would a parent who's not concerned about concussion raise their hand? Is there any parent left that's not concerned about concussion? And I know the young athletes have heard a lot about it as well. And listen, it's a serious topic. I mean, concussions are brain injuries. And I'm going to blow through some slides here. It's late, and I'm standing between the parents in dinner and the athletes in football, so that's a great place to be. Let's see if we can get through this. A concussion, okay, look at all these words at 6 o'clock at night. A complex pathophysiological process affecting the brain induced by traumatic biomechanical forces. That's perfectly clear to everyone in the room, right? Let's break that down a little bit. So that's physician talk or scientist talk for meaning that there really is no such thing as an easy brain injury. They're all complicated. There's no such thing as an easy concussion. Pathophysiological means that most of these injuries are not a real structural damage to the brain. It's more of a short circuitry type of issue. There may be some microscopic damage, and trauma-induced, a blow to the head or a blow to the body. And remember now, it's distinctly unlikely in sports concussions for your athlete to lose consciousness. Less than 10% of concussed athletes will actually lose consciousness. So I guess one take-home point is you don't have to be knocked out to have a concussion. I think the world understands that. What happens in terms of that pathophysiology? So for the middle schoolers who are just now learning about cell biology, and for the parents who thought you'd never have to think about it again, let's bring everybody to the middle here. So what happens to the brain when it's concussed is that certain parts of the brain that are injured lose their ability to maintain osmosis and homeostasis. Remember those words? There's a chemical gradient across the cell. And that ability to maintain the way that the chemicals are to work is lost. You have to fix that. And to fix that so that your brain works correctly again takes energy. Like anything else in the body, it takes fuel. It takes fuel to run. It takes fuel to think. The brain doesn't store fuel, so the term fathead is really wrong. You know, the brain really doesn't really store fuel, so the only way you can get fuel to the brain to fix the cells that don't work is to deliver the fuel via the bloodstream. But unfortunately, the part of the brain which is concussed, which needs more blood flow, actually gets less blood flow. So herein lies the dilemma. Basically, you need more energy, but you can't get it there, so the brain has a bit of an energy crisis. And until that energy crisis is fixed, the brain tissue is vulnerable. And herein lies the opportunity. Listen, I'm not very worried about the first concussion. Concussions have been going on forever. We don't want you to have concussions, and this school system has made, this program, this junior football program has made great strides in stopping that. But most concussions do fine if you treat it correctly. The mistake is to try to do something where you could get concussed again before the brain recovers. That's the key. The brain does get better, but nothing makes the brain better after a concussion except for time. I mean, it helps to ice your ankle, pretty much doesn't help to ice your head. It just doesn't work. I have discovered that the only advantage of getting older is it takes kids longer to recover from concussions than it does adults. So it's just the one time where being a kid doesn't help. So in the Seahawks, you may see us have a player get concussed on Sunday, and he may play next Sunday. Do not use that as a benchmark for your young athletes. So what takes 5 to 7 days in adults can easily take 10 to 14 days, if not longer, in young athletes. The key here is to get well. And for the football players, listen, I get it. You have to be tough to play football, but no one has a tough brain. Playing with concussed symptoms is a bad mistake. Even if it doesn't cause catastrophic consequences, you can make a 2-week injury into a 2-month injury. So we need to be careful to treat these with the respect that they deserve. And if you treat them correctly, most of them get better. So think about this. If your son or daughter is concussed, they're basically running a slower software program. It just takes longer to process things. It's not that your brain is broken, it's just slowed down. Pictures of the brain, CT, MR, those others they will be normal, the traditional pictures. And just because you go to the emergency room and the doctor tells you your CAT scan is normal, doesn't mean your son or daughter is not concussed. Very rarely are the pictures abnormal. Remember, it's mostly a functional thing, not a structural thing. It's also not just a football thing. If I can leave you with some, there's a few things to remember. You don't have to be knocked out to have a concussion. You have to give concussions time to get better. And this is really not a football thing. It's not just a boys thing. There are concussions in all sports. There are concussions in football. But you know what? Even more recent research that we've done at the University of Washington suggests that probably the rate of concussion in high school girls soccer is about the same as it is in high school boys football. And in college, the rate of concussions in women's soccer is higher than in men's football. The number one sport in college for the rate of concussion, women's ice hockey. So it's not a boy thing, it's not a football thing, it's both genders, all sports. So for those of you who have cheerleaders here, and many of you have daughters who are not here, all sports, both genders. Turns out that when boys and girls play sports by the same set of rules, basketball and soccer, the concussion rate reported in girls' sports is tremendously higher than in boys' sports. Now, Rob brought up some issues. Maybe it's neck strength, maybe it's other issues. I have a theory as to why this might be, and that may be that girls are smarter than boys and they actually tell you when they may have symptoms. So, yeah, I have a daughter and a son, so I have personal experience on comparing the two. So, once again, please, any blow to the head or a blow to the body with force to the head, a change in behavior, son or daughter, nephew or niece, think concussion. Remember, if you treat this correctly, the outcome is very favorable for the great majority of people. There is not a concussion crisis. There have been concussions since forever. It's a Latin word. There's a better awareness, but this is not a new injury. We just know more about how to treat it. So, recognizing a concussion, I think this is the part of the presentation, this is where I need your help. At the Seahawks game, there are 27 medical people on the field. It's an AMA convention. You're tripping over doctors to get on the field. I'm not worried about access and who's going to see the concussion. We have all kinds of resources. At your son's practice and your daughter's cheer practice, they're not going to be healthcare providers here. Now, luckily, you have a player safety coach, but the partnership between you folks and us on the medical side is that we hope that as a parent or a coach that you will recognize signs of a potential concussion. And this material is readily available. I'm assuming you download it from the CDC. You can get this to every parent. Every coach can have it on their clipboard. We have it with us. We'll give it to you at the end of the presentation. We'll put the forms out here for you. If we can get parents and coaches, which I think the culture is already very good here, to look at these issues, and we can get the athletes themselves to report signs where they feel different or a buddy of theirs feels different. Listen, when Zackery Lystedt was hurt, his teammates knew. He was asking them, where does he stand? Where does he line up? He couldn't remember the place. His teammates knew. They just didn't know to report. And they will carry that burden with them forever. Because if Zackery Lystedt, who was concussed, had simply been taken out of the game, he would not have had the severe brain injury that he suffered. So listen, if you suspect a concussion, remove the athlete from practice or play immediately. It is a law, but it's simply the right thing to do. These are children. These are children playing a sport. If you suspect an injury, just take them out. If every athlete you remove with a suspected concussion ends up having a concussion, you're not taking out enough kids. Just like at the hospital, if every person we see with chest pain really has a heart attack, we're not seeing enough people, right? You want the bar to be low here. Remember, if you just take them out, bad things will not happen. And they cannot go back because of their Lystedt Law until they're cleared in writing, which I think is appropriate by a healthcare provider. And it's important, and I think you've already set the culture here, Rob, where the coaches you'll have a protocol in place, so if there's a suspected injury during practice, someone will have eyes on that young athlete. They don't go in the locker room by themselves, they're observed to make sure they're okay, and a plan is put in place, which is really spectacular that's being done here. So remember, if an athlete's pulled out, they can't go back until there's written clearance by a licensed healthcare provider who's trained in concussion. And for the WIAA, the State of Washington Intercollective Association, and I think for your league too, the rules are pretty much the same in that in the State of Washington it's a physician, a physician's assistant, nurse practitioner, or a licensed athletic trainer. The first thing that I think, when it turns out to be my job, what you will hear from a good concussion provider is that when your son or daughter has a concussion, grandson, granddaughter, rest is the key. So this is not like a sore hamstring where I'm going to exercise a little bit and push through it. This means physical rest. This means daily activities only, and also some relative cognitive rest. I've always, the idea of resting your brain, don't exactly rest your brain, although I've said it's certainly easier for some people than others, it seems like, to not use their brain, but you have to use your brain for daily things. But I'm talking about maybe backing off on schoolwork and homework and video games, unfortunately, and texting and the things that people like to do. So the idea is to physically rest and to sort of rest your brain enough so you don't produce symptoms. If you produce symptoms, if your son or daughter is concussed and they do something that gives them a headache, they're not damaging their brain further. You haven't taken away Stanford or Harvard. Don't worry, it's still on the table. You're just prolonging their recovery. And I argue that as important as junior football is, and as important as cheerleading is, these young people in this room are not just athletes, right? There's an adjective that comes before athlete here, right? They're student athletes. And it's bad to miss 3 weeks of football, right? It's bad to miss 3 weeks of cheer, but it's also bad to miss driver's education and homework and social development and everything else that goes along with a concussion. And for the middle schoolers, it's even more important because they're making that transition now to more an academic load. You don't want to do that. You don't want to make a 2-week injury into a 2-month injury. And let me just say at the end of this, you see that last bullet point? The idea that you go see a healthcare provider and they say your son is cleared in a week, you never manage a concussion by a calendar. It doesn't work that way. You manage it by signs and symptoms. So there is no magic timeline. Each concussion is different, and 2 concussions when the same person is different. So we need to be understanding that this is not something you can set a calendar to and say, all right, in 10 days you'll be good to go. The good news, folks, is that the great majority of sports concussions are better in about 7 to 10 days. It does take longer in this group, in this room tonight. But the good news is if you do this correctly, the great majority of concussions are better. And even people who suffer concussions do very well later in life. It's uncommon for 1 or 2 concussions to lead to devastating consequences if they're managed correctly. Remarkably uncommon. I know this is, the media seems to have gotten ahead of this, but if you do this correctly, most of the athletes will do fine. You don't want to go back early. As we've said, you can have, if you can take a concussion that turns into bleeding within the brain. And at Harborview, we see over 2,000 brain trauma cases a year. And many of those are people who had big falls, but also sometimes a person with a little concussion who then had another blow while they were still symptomatic. Sometimes in young people, you can get severe brain swelling. Multiple concussions, particularly those close together, increase your likelihood for future concussion. And these things on this slide, the great majority, actually every one of them, is preventable with proper management. So sports have a risk of concussion, but the most dangerous thing your child can do after school is ride his or her bicycle or take a car ride. The rate of brain injury from car accidents, skateboard accidents, and bicycle accidents is much higher than from any sporting activity. If you play sports safely, as it's been organized here, it's really pretty safe for your brain if you manage your concussion correctly. We have had some success with our work with the Lystedt Law and others in changing the behavior of coaches. I want to take you guys on the road with me. I mean, if every school did what you did, I could go home on time at night. I don't have to give this lecture anymore. This is it's really remarkable. So coaches have come around and parents have come around. We're trying to work on healthcare providers. So I'm going to give you a little advocacy minute here about what you should expect from someone if you take your son or daughter to see a healthcare provider if you think they've had a concussion. I think it's reasonable to ask that healthcare provider, do they know the subject material? Are they current? Do they know about, I mean, it's okay to say, what's your experience, what's your understanding, what's your breadth and depth of knowledge? Do you have, what are the components of your concussion team? Do you have a neuropsychologist in case we need more sophisticated testing? Do you have access to a neurosurgeon in the hospital in case we need surgery? Do you work with the school systems on modified learning programs? And as we all know, if you're going to see your provider for concussion, he or she needs to be available, right? So if a concussion occurs on Friday, you want to be seen on Monday, and then they need to be available for follow-through and stay with you every step of the way. There's a group of scientists and physicians who met in Zurich. There's a meeting every 4 years. It's an international concussion consensus meeting, and where some of the best minds get together and talk about what the world should know about concussion. And we have decided that, listening to that group and following what that group has said, you know, if your child's concussion falls outside this expected 7 to 10 day window, that's probably time to seek care or ask your provider if they have the expertise to manage this, because you're outside the bell curve now. And there's many things that can be done in that 1 to 2 week category that may help differentiate concussion from other problems and also speed along recovery. So I think that we're working now in a big way across the country with many healthcare providers and professional medical organizations to try to help their doctors understand this injury. The doctors have to catch up with the parents and the coaches. So make sure that your son or daughter is seeing the right person if they happen to be concussed. So listen, this is easy. Don't let an athlete with a suspected concussion back into practice until they've been evaluated and cleared in writing by a licensed healthcare provider who's trained in the diagnosis and management of concussion. This program supports it. This program has mechanisms in place to make sure that happens. They're your children, it's our responsibility, and if we do this, we can help keep sports safe, as has been demonstrated here at Eastside Catholic.